Hi, I'm Deb Hutcheson, Assistant Professor and Vice Chair in the Department of Sports Medicine and Nutrition at the University of Pittsburgh. And I'm also Director of the Coordinated Master in Nutrition and Dietetics. So as part of our nutrition-focused physical examination, we are going to look at two individuals, Josh and Emily, both an example of normal physical status in a male, and then we'll look at differentials in a female. Josh is a 34-year-old male, and he has no deficits in intake, no recent weight loss. Emily is a 24-year-old female. She also has no deficits in intake and no recent weight loss. So both of these are examples of normal. As we go through this physical examination, we're going to be looking at body composition for macronutrient deficiency, for fat loss, muscle wasting, and we will also look at edema, which sometimes may mask loss of body composition. So we're going to divide up into fat sites and muscle sites. Normally, when I give an examination, I would be doing it all at the same time when I'm in the particular location in a head-to-toe physical exam. But for the sake of grasping it on the video, we'll separate them. So when we look at fat loss in an individual, we're looking at three sites. We're looking at the orbital fat pads. We're looking at the triceps, fat over the triceps muscle, and we're also looking at the anterior ribs in the lower back from the anterior axillary line to the posterior axillary line. So for the muscle assessment, we're going to look at 7 sites, 5 upper body and 2 lower body sites. In the upper body, we have the temples, the clavicle, the shoulders, and around back the scapula. We also have the interosseous muscle. In the lower body, we're going to look at the thigh and the calf muscles. So we're going to evaluate him also for fluid balance, looking for edema in any of the extremities. And since he is ambulatory, I would expect that if he had edema, it would be pulled down by gravity. And the first place we would probably see it are in his legs, his lower legs. And we will also look for edema in his arms and his face, and we will look for edema in his abdominal region or ascites. So generally, when we do a malnutrition physical assessment, we like to do a head to toe. And I am going to, just for illustration purposes, separate the fat assessment from the muscle assessment from the edema. We're going to start by assessing fat sites. So the first sites we would assess are the orbital fat pads. As we saw in our lecture, the orbital fat pads are above the eye and below the eye. We're going to look at the fat pads below the eye, and we're also going to fill the area. All right? You should see no flattening under the eye, and you should feel a spongy fat pad under the eye. If the area is flat, if it looks like the eye is hollowing with dark circles, that might indicate there are signs and symptoms of loss of fat in that particular area. However, you need to clinically correlate that with any loss of appetite, any loss of weight in the individual by not making assumptions. For example, in a person who has an allergy, you may see dark circles, you may see capillaries close to the surface in an inflammatory reaction, and that would not be an indicator for malnutrition. So there are many differentials. In an elderly person, you're going to see fat being pulled down by gravity. So you are going to see fat pads, but they're going to be lower than they would be in a normal young individual. So things that you need to be aware of. The next site we're going to look at is the triceps. And generally when I do the triceps skin fold, I take the arm at the elbow and I hold it and just relax and allow the person to put their weight on my hand because I don't want to grab any muscle in this. And I'm pulling down on his fat. And if you can see, Josh, even though he's well muscled, thin, he has a good amount of fat on his arms. And so I would say this is a normal fat in an individual who's 34 years old who's active. If you had an elderly person, you might notice that their skin kind of pulls away from the bone, is more hanging. It's not important what it looks like, it's important is what is between your thumb and your first finger when you're identifying fat loss. It's not. You will also see that their skin is very compressible. we're going to look along the lower ribs. And my hand is cold. If I touch you, don't jump a mile. You're going to look at this area along the lower ribs, and what you're going to look for is any hollowing, any noticeable ribs, and any loss of fat. You can also pinch up a little bit of fat to make sure, and as you can see, Joshua has an adequate amount of fat in this region. All right, so those were our 3 fat sites. Not only would we identify whether there was a normal, mild, moderate, or severe loss in those areas, we would, at the end of our examination, give 1 value for fat loss in the body. And here we'll start with the temporal muscle. Okay, and we're going to move our hands. We're going to palpate, and we're also going to look. When I look at Josh's face, I do not see any hollowing in the temple region by the eyes. Okay, I don't see any eyebrows protruding, a loss of muscle mass in the frontalis muscle area. So the next thing I'm going to do is feel from the lateral canthus of his eye back through the temple region. All right, could you clench your back molars, Josh? All right. When he clenches, unclench, please. When he clenches, I can feel a tightening of the muscle mass and covering the bones in this region. I do not feel any bones. I feel nice hard muscle mass, which indicates that there is no loss of muscle in the temple region. The next area we're going to look at is the clavicular region. Now, as you can see, the bone is a little bit apparent in Mel, but he has good, nice, hard muscle here. If he did not have this muscle, you would see hollowing around this bone. Josh, can you just bend yourself forward? See, I can reach in and grab this bone. This is what a malnourished person might look like. You would not see this muscle mass. All right, and you can see how that muscle mass fills in and there is no hollowing along the clavicle area. Now, in an elderly person who has any kind of loss of stature, and you see that curvature to the back, this area would not be able to be assessed, because just as Josh curved his back forward and you saw hollowing in this area, that would be the natural status of an individual who is elderly, who has the back. So you want to make sure that the individual you're looking at has good posture and is able to hold their back straight when you assess this area. Okay, the next region we're going to look at is his shoulders. Now, when looking at the shoulders, you not only want to look at the deltoid muscle, the pecs in this area, the trapezius that comes up over the back. You want to look, and as you look at this area, you should see a nice amount of muscle. You should see rounding of the deltoids. You should not see the bone sticking out. And if you remember when you were doing your anthropometric measurements when you were in school, you look for the acromion process. You should not see the acromion process protruding in this individual. So when I inspect Joshua, I see good muscle mass, I said good rounding of the deltoids, good pectorals, and I see a good trapezius muscle. When I feel this area, when I squeeze the muscle, I can feel the muscle mass in his shoulders. I'm not reaching in and grabbing bone in that area, which indicates a good muscle mass in this individual and no signs of muscle wasting in that area. The next area we're going to look at is the scapula. When we come back at the scapula along the rear of the back, again, this nice big trapezius muscle comes over. Deltoids are putting muscle around the side. You have your rotator cuffs back here. So you have some deep muscle, you have some superficial muscle. So the scapula should not be apparent. Now, when we look at the scapula, we have the opportunity to engage this muscle very readily. So there are one of two ways you can do it. If your patient is mobile, you can take them near the wall and have them push their hand into the wall to engage the muscle. And what you would be inspecting for is any hollowing around that scapular area when the muscle is engaged. Or you can have your individual push while you're viewing, if they are bedbound, against your hand, and you can see in this region that there's no hollowing, good muscle mass, no protruding of the scapular bone, So this indicates good muscle mass in that area. Josh, would you come stand against the wall for us? And straighten your arm, press it against the wall, and again, look at the muscle mass in this region. Good muscle mass, no loss in this area. No hollowing, no protruding of the bone. Thank you, Josh. All right, and we've gotten 4 out of the 5 upper body areas. The last upper body area we're going to look at for muscle wasting is the interosseous muscle. And the interosseous muscle is right here. You pinch. See how the interosseous muscle comes up when he pinches? Relax. Pinch again. So you're going to ask your individual to make the OK side. And you're going to have them pinch the pads, their first finger and thumb together, and you're going to look for the bulging of this muscle. In a male, you will see a bump in this muscle. In a female, you will probably see a flattening in this muscle, unless, of course, they are rock climbers. You may see a bulge in a female rock climber because they've developed these muscles. Now, in an elderly patient in this area, you're going to see a loss of subcutaneous tissue, and their bones, their muscles in their hands might be more apparent. However, that muscle still should respond. And when you feel it, it should be nice and hard and not soft and spongy. Lower body, we're going to start with the thigh and the calf area for our last 2 muscle wasting. So what we're going to do is we're going to ask you to take your shoe off, Josh. That would be great. And if you would sit up on the table like you were in a bed. That'd be great. All right. So if you had a patient who was bedbound and you wanted to look for muscle wasting in the thigh, first thing you're going to do is inspect. And if we look at this muscle, we can see the nice curvature of his thigh, indicating that there's muscle mass. Without this bulge of muscle, the leg would be straight. So the first thing I'm going to do is feel his muscle without it being contracted. And you can see there's bulk to the leg. Now I'm going to take and I'm going to flex the ball of the foot and engage the muscle. And now you can see that I cannot compress the muscle. Very strong. Relax again. Watch this. Now engage. And this is what you want to see for good muscle bulk. You also can look at the calf in this position. Foot up at the 90-degree angle. You can also do it flat in bed. It's easier if they can bend their knee. And again, as you compress the calf, you can feel the bulk, but it's not engaged. Now I'm going to flex the foot and engage the muscle, and you can see how little compression you have. Nice muscle bulk in that area. So we have just now looked at all 7 sites for muscle wasting, and as one can see, Josh has good muscle mass and there is no wasting in this individual. Now, since Josh is ambulatory, I am going to look for signs of edema in him. My first thought would be that he might, if he was going to show edema, show it in his lower legs. So in assessing for edema, the first thing I'm going to look at, since he had socks on, I take off the sock. If there were edema, I would see a loss of contours on the foot. I would see swelling, I would see indentations where there was tightness of the sock, and I see none of this. So that leads me to believe by inspection there is no edema. But now I will take the time and palpate this area. And starting at the medial malleolus and coming up about, I would say about an inch above that, I'm going to start pressing. I'll press in on the tibia for about 5 seconds. And I'm going to release. And I'm looking for any indentations that stays. Josh's rebound is about 1 second, shows no signs of edema. If, however, I had noted that there was an impression left for 5 seconds or longer, I would continue to check for edema all the way up until there is no more edema, so that I could chart how far the edema extends. Now, if Josh were bed-bound, I might look along the sacrum of his back. And remember, fluid flows to the lowest center of gravity. So his back would be lower, and I would do the same thing, palpate for edema in his sacrum. Also, he might be hospitalized and have fluids going in, or for whatever reason have an inflammatory reaction, and I might want to check his extremities for edema. First thing I would do again is look at the fingers, look at the arm, look for any signs of any kind of swelling in those tissues. Seeing none, I again would press for 5 seconds. And again, his rebound is very quickly, within a second, so no signs of edema in the extremities. Another area I might look, if Josh were in bedbound, is in the eyes, right under sometimes that orbital socket, as I did with fat wasting. That's an area where fluid might collect if somebody is lying in bed, and that's a really good area that one might check for edema. It also may fill any empty spots in his face, and sometimes that edema would mask any loss of tissue. When you see an elderly person and you start to see that they don't have any wrinkles and they're 75 years old, that's not normal. So one should suspect edema in that type of population when you see something that is not normal. Ascites. Josh, could you lay down for me for 1 minute? So ascites, again, I would start by inspection. Again, I would have looked at his history to determine is there any reason that I might suspect edema. As I inspect Josh's abdomen, I can see that there is no swelling. The flanks are not bulging. I would also move to the foot of the bed and look up, and if he had bulging flanks, it would be very easy to see. If I suspected that there were edema in this individual, I would take the time to percuss across his abdomen, going from flank to flank. And as I moved across, I would hear a change from dullness over the fluid area to tympany, where there is lack of fluid. And that's it.
So now you've seen the physical examination sites in a normal male. Now we're going to move on to look at differentials in a normal female. Again, Emily is a 24-year-old female.
This is Emily, and Emily's here for a malnutrition assessment today. So Emily has agreed to a nutrition-focused physical assessment today for malnutrition. And I want to show you some differentials between a male and a female, and also how to discreetly disrobe an individual in the hospital. So Emily has no weight loss recently or in the past of any measure. She also has no intake problems. So we've also identified those two criteria are within normal bounds. Now, if I look at Emily's face and I look at her eye area, again, if you look for any hollowing, any darkness under the eye, again, I told you some differentials are allergies, where we might see that, where the capillaries come to the surface. Emily, do you have allergies?
I do.
Yeah, and you can see on Emily's eyes a little bit of darkening under there, which is perfectly normal. And again, these are things your patient knows the information. This is your best person to go to ask for when you see something that might be something you would mistake for malnutrition. But again, if I look, she has good solid fat pads under those eyes. When we're looking at the upper body of a female, you might see there is less muscle mass. Sometimes the scapula and the clavicle are more pronounced in a female, but we're looking for good muscle tissue. Now, when disrobing an individual to look at their muscle tissue, you want to be very discreet and only uncover that what you need to look at that present moment in time. So I want to look at Emily's clavicle. So if we look at her clavicle region, we can see that her clavicle was more apparent than Joshua's. We also might notice that we can see where her acromion process is. All right? We can see the end of her clavicle. This just does not mean malnutrition. We have to clinically correlate it with whatever else is going on in Emily's life. But when I look for muscle mass, I can feel good muscle mass in this area. So indicates to me that there is no malnutrition. And again, now I'm going to check the other side. Gently
Only show the area that I want to look at. Good deltoid muscle, good clavicle region, and good muscle mass in this area. Even though the clavicle is apparent, she does have muscle mass visualized. If I look at the shoulders, I'm going to pull this down so I can see both shoulders. And you can see that Emily has good muscle mass in the shoulders. When I push in, when I feel and palpate her deltoids, I'm not grabbing bone, I'm grabbing muscle mass in that area. If we come around to the back, and we look at the scapular area, we can again see the scapula is more apparent. Now, Em, if you could lift your arm and push against my hand, we can see not any hollowing. The scapula does not protrude, and there is muscle mass. Even though her normal is apparent, there's good muscle mass when she presses. Okay. So even though these individuals were both different, they are both normal. And that's one of the things we'll find. There are many variations of normal.
After we've evaluated our individual for fat loss, muscle wasting, and we've looked for edema, we're going to check the functional status, which is a indicator of lean body mass. And we're going to use a hand dynamometer to do this.
Okay, Emily, this is the hand dynamometer, and it's going to give me a little idea of your muscle strength. All right, so what I'm going to ask you to do is I'm going to ask you to put it in your hand and hold it. You want your arm bent at a 90-degree angle, and then when I say go, you're going to squeeze as hard as you can. When I say stop, you stop.
Okay.
Okay? And we're going to do several trials on that, okay? So I'm going to strap this around. You want to do this hand first? All right. So we're going to start with our right hand. Is your right hand dominant?
Yes.
Yes. All right. Go ahead and put it, your right hand around the instrument. And as you can see, Emily has it so that her thumb and her fingers are wrapped around. And it's not too tight. It's on the second position. All right. Let it go. I'll hold it for you. Now you're putting this hand around it. Let it go. And the idea would be for you to hold the weight. We want her arm at 90 degrees, and for me to hold the weight on my palm so that she is using all her strength on the hand dynamometer instead of her having to hold the instrument up. Okay, Emily, when I say go, 1, 2, 3, go. All right, stop. Excellent. Okay, you can release. And I would take a recording of her muscle strength and then zero it out again. Now we're going to check your left hand, Emily, same way. Okay, hold that. I will hold the weight, relax, 90-degree angle. Okay, 1, 2, 3, go. Stop. Very good. All right. You should give a little 30-second break between arms.
So that's the conclusion of the physical examination for malnutrition. You've seen a normal body size for fat loss, muscle wasting, we've looked for edema, and we've checked functional status in both a male and differentials in a female. I hope this has been very helpful as you conduct your own physical examination for malnutrition. Thank you.